Hi friends, welcome back to my channel. Today we are going to see about the joints. Let's go to the joints. A joint is the site at which any two or more bones articulate or come together. Joints allow flexibility and movement of the skeleton and allow attachment between the bones. In bones, it means this is the articulation point. Two bones, 1 and 2. Any two bones, it attached together, it's called as joint. In body, lot of joints are there. Let's go and see what are the joints. Let's see types of joints. There are three types of joints are there. First is the fibrous joint. Second one is cartilaginous joint. Third one is synovial joints. There are three types of that. First we are going to see about the fibrous joints. The bones forming these joints are linked with tough and fibrous material. These joints are made up of thick and tough fibrous material in joints. Such an arrangement often permits no movement. For example, the joints between the skull bones. These joints are having no movements. This is very important point because these joints are have no movements. Okay, because it is very tough and unmovable. This example is skull bones or skull joints. We know already skull bones are flat bones. It is arranged by the fibrous joints. Next, the sutures are completely immovable. The sutures also combined by the fibrous joints. Next, and the healthy tooth is cemented into the mandible by the periodontal ligament. The tibia and fibula in the leg are held together along their soft by a sheet or fibrous tissue called the interosseous membrane. We already know tibia and fibula and the ulna and radius all are attached by the interosseous membrane. So this sheet is arranged in the interosseous membrane. Which sheet? The fibrous joint sheets. Okay. Next, this fibrous joints allow limited amount of movement and stabilize the alignment of the bone. This is have limited movements only. This is not completely movable. It have little movement only. Next one is the cartilaginous joints. Cartilaginous joints. Joints are formed by a pad of tough fibrocartilage that act as a shock absorber. These joints are very useful because it is a shock absorber joints. The point may be movable. These joints may be movable, but it is not completely movable. As in the cartilaginous epiphyseal plates, which in the growing child links to diaphysis of the long bone to epiphysis. This is appear in the diaphysis and epiphysis between the bones. Some cartilage joints permit limited movement as between the vertebrae. We know the cartilaginous joint have example of FIBROUS. Vertebrae have limited movements only. It has separated by the intervertebral discs or at the symphysis pubis. Another example is symphysis pubis. This is also have limited movements. During pregnancy, the hormones allow for expansion during the childbirth. This cartilaginous joint have benefit to circulate the hormones in childbirth, pregnancy to allow for the expansion during pregnancy. This is the very important one in symphysis pubis. This is also cartilaginous joint, and vertebrae also cartilaginous joint. Another important joint is synovial joint. It is very important in the synovial joints. It's very important because it is have in body lot of places. Let's see the synovial joint. Synovial joints are characterized by the presence of a space or capsule between the articulating bones. This is one bone and this is one bone. It have the capsule or space. It is synovial joint. All synovial joints have the capsules. The ends of the bones are held close together by a sleeve of fibrous tissue and lubricated with a small amount of fluid. Synovial joints are the most movable of the body. Synovial joints have lot of movements. It's also freely movable in our body. Synovial joints is differentiated between another two joints because it have lot of movements. Synovial joints have the fluid also. It is called as synovial fluid. In next class, we will see characteristic of synovial joint and the capsular ligaments and synovial membrane and other intracapsular structures. Okay. If you like my videos, please subscribe, share and comment. Bye.